A regional consultative meeting is underway in Harare, bringing together stakeholders from 14 countries to review progress in scaling up pediatric HIV and AIDS provider services. HRS CAT gives us more on some of the issues emerging from the meeting, which kicked off on Monday.
The meeting aims to accelerate efforts to end AIDS in children and adolescents by 2030, aligning with the global targets.
If we compare with the figures for children, we're only at 63% of the children knowing their status, 57% were on ACT, and less than 50% were virally suppressed. So we know that about 660,000 children living with HIV were not on ACT, and as a result, children accounted for 13% of AIDS mortality in 2022, even though they only comprise 4% of people living with HIV. So these are very sobering figures that are really highlighting these inequalities that are still being faced by children.
Key discussion areas include expanding pediatric HIV testing and treatment, enhancing adolescent-friendly services, addressing stigma, discrimination, and strengthening community-led initiatives.
It is crucial that we support children and adolescents living with HIV through focused service delivery, age-appropriate resources, and psychosocial and mental health interventions to achieve positive health outcomes. In 2022, the Global Alliance to End AIDS in Children by 2030.
Representatives from governments, civil society organizations, and international partners are sharing best practices and challenges.
So we need to use some core structures to enhance priorities that matter. So firstly, purpose, we want to end AIDS. We need to involve the people. We need to think about the processes as well as monitoring the performance.
Expected outcomes include revised national strategies for pediatric HIV and AIDS, increased regional cooperation and knowledge sharing, also enhanced support for community-led initiatives.
Policies and plans, I think it's very key that we work with our national governments as we pilot and scale up these peer models, and I'm glad that almost every one of us was making reference to their Ministry of Health, to their national governments as they implement this work. We also need to make sure that we commit resources. We have heard that we have realized some substantial investment in terms of financial resources from developing partners, but also national governments.
The meeting is organized by Zandiri in partnership with the Ministry of Health and Childcare.
The goal is to support governments, implementers, even young people to how do we scale and finance and sustain peer models at scale like Zandiri. It draws on our program and research experience and data from Zimbabwe, but also what we're all learning together, and of course the WHO guidance.
The meeting's outcomes will inform national strategies, ensuring no child or adolescent is left behind in the fight against HIV and AIDS. For ZTN Prime, I am HRS CAT in Harare.
Konapo ipapo ba ZTN Prime, DSTV channel 294, the place to be.